In this video, I want to chat a little bit about how to avoid wearing a denture. And really there's two different approaches here. Number one, if you still have your teeth and you want to avoid losing your teeth and ending up in a denture, well then the key to success here are regular and frequent hygiene visits, or cleanings as you may call them. So the whole purpose of a cleaning is to clean the infection out of the gums and prevent that infection in the gums from eating away bone. So the number one way people lose their teeth, if you imagine every tooth you have has a root, it's how to multiply bone, is when we don't get our teeth cleaned often enough, the gums get infected, the infection in the gum eats at the bone, we lose all the bone, the teeth get loose and fall out. So the key to success if you have your teeth is to go very frequently to get your teeth cleaned. Discuss this with your dental team, but at least every 3 to 4 months as an adult, and we have people that come 5 or 6 times a year to get their teeth cleaned, where that's what's best for them in order for them to save their teeth. Now, if you have already lost your teeth and are wearing a denture and you want to avoid wearing a denture, the only way you can avoid wearing a denture is getting into something called dental implants. Now, with dental implants, if you have a denture, you really have 2 options of dental implants. One option is we would place dental implants, for instance 2, into the mouth, or 4, and then you will still have to have a denture, but your denture has these little locators, are called, that snaps or engages into the implant. So you're still wearing a denture, you're not getting rid of it, but it makes the denture or enhances the denture considerably. It's still a bottom denture or still a top denture with all the stuff on it. Now, if you want to take it a step further and go, I do not want to wear a denture that comes off and on that's big and bulky, then we have to get into something called all-on-4 technique, or a hybrid, or a denture that screws into implants. They all mean the same thing. And what's involved in this is placing multiple implants, cutting off the palate, punching holes in it, and screwing it into the implant. So this, believe it or not, is a top denture, but when you screw it in, it's screwed into the 4 implants. It stays in there, does not come off and on, and is an alternative to having a denture. And you can do the same for the bottom. So it's actually still technically a denture, but where it's fixed in, does not come off and on, screwed in, and definitely has lost all the bulk of a denture. It doesn't feel like a denture. We actually call it a hybrid or all-on-4, and is an incredible difference in having a denture. So in this video, I want to take some time out to explain how to prevent having dentures, or how to not have dentures.